bring Greg into this discussion in a minute, but we know that for any patient, male or female, old or young, fit or not fit, just hearing the word cancer is hugely overwhelming for anybody. But for women who are diagnosed with these cancers of the reproductive tract, where there's the threat of losing your uterus and having to undergo surgery, there's a huge emotional component to the loss of those organs for many women, even those women that don't have cancer who may need a hysterectomy. And I think that often those emotional issues are not addressed. Before I come on to bring in Greg's thoughts on this, Michelle, the emotional effect of hearing the word that you need to have a hysterectomy and the potential hormonal upset that may or may not go with that, was that a big part of the concern for you, or was the diagnosis of ovarian cancer itself just so overwhelming?
You know, for me, I never really freaked out. I'm a very realist kind of a person, so I tend to be very quiet, and then I like to get all the information, and then I go off of that. Emotionally for me, it hasn't been that hard. It's been more hard for me worried about everybody else, because I've always been the caregiver, and so now I'm in a different role where they need to take care of me. So I feel like I need to be strong and don't lose it. But you know, the whole losing the hair, and I don't know. I don't think you've ever seen me wear a scarf or a wig. I just felt better and felt more like me, just going out bald.
Greg, Michelle's already touched on how we girls tend to talk about issues that affect us with bladder control, with hormonal issues. And although we talk about it all together, often it's the guy that you live with that's has to bear the brunt of all the emotional fallout of the hormonal issues. I remember a few years ago there was a big front page article in the tabloids about the risk of hormone replacement therapy and ovarian cancer risk. And I remember my 96-year-old grandfather reading this article on the front page of the Times, and after nearly an hour of studying this article, he asked me, "What is an ovary?" To hear a diagnosis of ovarian cancer,
I knew what an ovary was.
Right. Well, that's a start. Right. But that alone must be a
but
very...
I thought they were up here. No, I'm kidding.
But does that, hearing that your loved one has a cancer, an ovarian cancer, not a sort of particularly common cancer, did that leave you with even more questions because we don't hear so much about it?
Yeah, I mean, I didn't know anything about it. I mean, really, you know, I just heard of it. So, yeah, I mean, we'd have conversation after conversation about it. Yeah, you kind of feel lost almost.
I'm sure.
Yeah.
And talking to friends.
Because there's a lot of emotion going on, so
sure.
you're like trying to explain it, or you're trying to process it, and you go, I don't have any information. I mean, it's just. Ugh.
And talking to friends and family when they learnt about Michelle's diagnosis, did they have a lot of questions about, you know, what exactly is that?
Yeah, so you feel like an idiot because, you know, they're asking you questions and I can't answer that. I don't know.
We don't know.
Yeah.
But, you know, surprisingly enough, when we started talking to people about it, you know, oh, my aunt had ovarian cancer. My grandmother passed away from ovarian cancer. A cousin had ovarian cancer, and she was 30. So, you know, you see it everywhere. I mean, I turn the television on, and there's all these drug commercials for cancers, and it's like I'm more aware of it now, where before I wasn't, you know.
And as we wrap up this segment, Dr. Secord, we have heard about how we deal with some of the medical decisions that we have to make in terms of making a diagnosis, considering the genetic changes that may put patients at increased risk. And you've talked already about the surgery and the chemotherapy options and how we have some newer therapies. But at the end of the day, there's a lot of emotional issues, financial issues that go with treatments, cancer treatments, particularly for patients. And this also has a huge effect, not just on the patient, but the family and the caregiver. When you talk to a patient who's just been diagnosed with ovarian cancer and they're on their cancer journey, what support services are there for people like Greg who have to pick up the pieces for a loved one that's just been diagnosed? How do we support the caregiver?
So we are fortunate to have a program and a team of social workers. I think you've worked with Mallory, and they're great where I offer patients their services because I recognize it is very difficult to cope with a diagnosis of cancer. So we have a great team that is very helpful, I think, to patients. I do have to say, in terms of Greg and other caregivers, that's an area we need to improve. So we currently have a study ongoing at Duke. It's called the HOPE study. And one of my partners who's also boarded in palliative care is running this study. And in this trial, patients were enrolled, and we didn't approach Michelle because you have to have a cancer that's not responding to the chemotherapy as well to be on the study. But what we found in this trial is that the caregivers really need more support. They absolutely do, and so we need to develop
that was my question to you.
more programs.
Do the spouse, the husband, the boyfriend feel very overwhelmed with not being able to understand all the nuances of this disease? I mean, we will be talking later about the effects of surgical menopause that's induced by treatments for ovarian cancer. I mean, how do we improve on that?
So we're going to need a team that's directed toward helping the caregivers. And if that team is the same team that helps the patients, that could work, but it may need to be a totally separate group of individuals that's honed into what are caregivers dealing with. And that's just the tip of the iceberg. I mean, we also know that patients and caregivers are dealing with financial toxicity and loss of work, and it just goes beyond so many things that we see in the office that happen once somebody walks out that door, right?
Final comment to Michelle and Greg. Michelle's already talked about how she's the caregiver and the silent stoic one. Obviously, when Michelle was diagnosed, she went through quite extensive treatment. How did that change the role for you as a couple, as a family, having to pick up where Michelle was steering the ship, as it were?
Well, first off, she has 2 dogs, so I became a surrogate for dogs.
Right.
Well, I had 3 dogs at the
Oh,
time.
yeah, that's right, 3.
Yeah, because my golden retriever was diagnosed with cancer a month after I was, literally a month later, and we had to put him down. So I'm like,
Yeah, it was.
Now what?
It was a lot. I mean,
it was a lot.
stepping in and doing a lot of, and what it's changed since the beginning. But I would do a lot of the things that she would do, in her house, and they weren't done the way she expected them to be done. So that was a big hurdle.
Did the treatments themselves really knock you about, the surgery and the subsequent chemotherapy?
The chemotherapy wasn't so bad in the beginning. I think it just, when you go in on the table and they cut you open and you get staples and they send you home, and in my situation I had a ventral hernia that was fixed, so I had those 2 drainage bags.
Right.
So, caregiver, I'm telling you,
Yeah.
for him to be able to do that and take care of me and, and give me shots in the stomach, those kind of things was a learning curve for him. And it's easy for him to, make a cup of tea or, cook a meal, but just the personal things and helping me. In the hospital, I had IVs in both arms, so obviously I couldn't go to the bathroom by myself. So I had help from him. And we had recently dated, so, I mean, all that stuff was on. It's like, this is life, this is what you have to do now to help.
And just to wrap up this segment, we hear this so often that as the caregiver, whether you like it or not, often you inherit a job that you're not trained for. You have no medical or nursing experience. You don't get paid for it.
No.
You may not necessarily want that job, but it's 24/7 physical and emotional, and you need your own support as well. Thank you so much to my panel, to Michelle and Greg, for sharing your story. I wish you well, Michelle, in your ongoing journey. And Dr. Secord, thank you for giving us such an expert insight into ovarian cancer and potential future therapies that can help prolong patients' life. Thank you so much.
Yeah, thank you.